Hello and welcome to Health Africa on AAU TV. AAU TV is the voice of higher education in Africa, and Health Africa is your favorite health show on television today. My name is Bridget Amadente. Today we are celebrating World Antimicrobial Awareness Week 2020. It commences from the 18th to the 24th of November each year, and it aims to increase awareness of global antimicrobial resistance and to encourage better practices among the general public and to avoid further emergence of drug-resistant infections. The theme for this year is Uniting to Preserve Antimicrobials. Statistics from the CDC, Center for Disease Control and Prevention, says that in the US alone, 2.8 million people have come into contact with antibiotic-resistant infections, and out of that same number, 35,000 people are dying each year as a result of this. This is just the US. Imagine what is happening in other parts of the world, on other continents. When it's brought together, it's just unimaginable. You have a reason to stay tuned. My name is Bridget Amadenta once again. I'll be back and then I'll introduce my wonderful guests. Do stay tuned. Welcome back. This again is Health Africa on the AAU TV. If you just joined the conversation, you're not late. You can follow the conversation on Facebook, Association of African Universities, on YouTube, Association of African Universities, and do well to check out our Twitter and Instagram handles. There's a lot there. So my guests for today are Ebenezer Ajare Bediako. He is a superintendent pharmacist. In fact, I didn't know that there was a superintendent pharmacist. And then I also have Selassie Thelma Amadumako. She is also a pharmacist here in Ghana. Ladies and gentlemen, you're welcome.
Thank you.
Thank you.
It's a privilege to have you here today. I know it's going to be a very interesting conversation because we've already talked about its background, in the background. So. Yes. So I'll start off. What is an antimicrobial and what are the types there are?
Okay, so
Ladies
first. So I'll go first.
Feel free.
Okay, so when we talk about antimicrobials, they are a group of drugs that kill or inhibit pathogenic microorganisms.
Okay.
When I say pathogenic, I mean microorganisms that cause harm to the body. Okay, so examples are bacteria, fungi, viruses, and protozoas. Okay, so examples of antimicrobials are antibacterials. Those are the common ones we know, like amoxicillin, flucloxacillin. Then we have antifungals, like griseofulvin and terbinafine, fluconazole.
Wow, that's a big
We have antiprotozoans, metronidazole. All these fall under the antimicrobials.
Okay.
Yes.
Okay. So when we say antibiotics, what are they? What are antibiotics?
Yeah, so basically, with the definition she gave, zooming into antibiotics. Antibiotics in general are medications, that are designed to kill bacteria. Okay, so basically that is the definition that I'll give to antibacterials.
Okay. What would you say is the best way to use antimicrobials?
Antimicrobials. Okay, so antimicrobials, as the name goes, they are designed specifically for a purpose, to target microorganisms, microorganisms that can cause harm to the human body. And so the best practices, for using antimicrobials are when it's being prescribed for the right purpose, prescribed by a qualified practitioner because they know why they need to prescribe these antibiotics. And of course, because it's designed for a purpose, it's for a particular duration. And so if it's used within the required duration and also the required amount, those are ways that, you can rightly use antimicrobials.
Okay, so the theme for this year's celebration of the World Antimicrobial Awareness Week is United to Preserve antimicrobials? What goes into it? What are the intricacies?
Yeah, so united to preserve antimicrobials. Over the years, what we see is that anytime we are having this discussion, in regards to antimicrobials, we tend to look at only the lay person, okay, or the general public. But in this case, we realize that other sectors also come to play. We are looking at the prescribers and also the policymakers. We all need to come together to, make sure that antimicrobials are being used well. Because if the prescriber is overly prescribing, and they are just prescribing the medications as and when they feel like, of course, it will be very difficult for the lay person to also, desist from taking it. The lay person will think that it's been prescribed, okay, and also I need to take it. The policy makers also need to come in to make sure that there are no spurious or substandard medications or antimicrobials out there. If they are all playing their role together, okay, we can all come together to tackle this fight against antimicrobial resistance.
Okay.
Yes, and to throw more light on what he said, these kind of awarenesses shouldn't be done on a yearly basis, okay? They should be done, in my opinion, on monthly basis, so as to create the seriousness of the awareness, because it's something that we always need to remember. If it's done on a yearly basis, who knows? It will be there for a short time, and after a while, everyone has forgotten about it. We go back to our old practices. So yes, they should be done regularly, and even it can start with our community pharmacies. Okay. We as health professionals, we are on the front line of this whole thing. So it is our duty, every pharmacist out there, and even doctors, nurses, it's our duty to educate the patients and the public on antimicrobial resistance. Okay, we make them understand the implications of abusing these antimicrobials or antibiotics, so that they know what they are getting into. Okay, so as to minimize or avoid antimicrobial resistance.
Okay, so you mentioned antibiotic resistance. What is antibiotic resistance? Okay,
so when we say antibiotic resistance, we are talking about when a bacteria, or let me say a microbe, okay, a microorganism develops the ability to overcome or to defeat the effect of an antibiotic. The antibiotic that was supposed to treat it, it overcomes the ability of that antibiotic. That is when antibiotic resistance occurs. Or when the antibiotic loses its ability to combat the microorganism, the pathogenic microorganism. So it works both ways.
Okay, and for which infections are caused by viruses and shouldn't be treated with antibiotics? You already talked about antibiotics. So which infection shouldn't be treated with these things?
Yeah, so normally viral infections, okay, we have, colds, flu, and other viral infections that we know. Mostly they are not to be treated with antibiotics, because antibiotics haven't been designed to target these viruses. And so if you are using them to target these viral infections, it's like you are rendering them useless. And over time, people build resistance to it. Because it's not supposed to be used for that purpose.
Why should I even care about antibiotic resistance?
Antibiotic resistance now is it's become one of the world's most urgent threats. Okay, because we realize that conditions that were easily treated with antibiotics now, they are no longer being treated. You can't treat them with these antibiotics that we have, and it's because of a practice that has existed over time. Okay, now it's very difficult to treat certain conditions, and it's more expensive to treat certain conditions. Unlike previously, where you could just take a simple antibiotic and then you are well. Now it's not like that, and so realize that antibiotic resistance is becoming a threat, and if we are not careful, it will get to a time that all the antibiotics will be done, and we can't even get some to use, and it's going to cause a lot of problems to us.
But why are they becoming resistant to it? you're a bacteria, there's a drug, so at least when you take you should be able to clear off the system. How are they being able to become resistant, and why?
Okay, so let me just start on a general note. Okay. First and foremost, I think it's important that everyone knows there are different types of resistance. Okay. There's the inherent one and there's the acquired one. Okay. When I say inherent, I mean there are some bacteria or microbes that naturally speaking, they are resistant to antibiotics because of their physiological makeup. That one is just natural. There's nothing you can do about it. Okay. And there is also the acquired one. The acquired one has to do with microbes that were once sensitive to the antibiotic. They were once sensitive to antibiotic, but have developed the ability to overcome them due to overuse and misuse of antibiotics, or let me just say abuse of antibiotics. Okay. So now we are coming to why they become resistant. Okay. So I like to use examples. There are ways I explain things better. So here lies the case where you have been prescribed an antibiotic and you're supposed to take it for the full course. Maybe you're supposed to take it for 7 days. And maybe after like 3 days or 4 days, you take it and you're feeling better. And you're like, oh, let me just, I'm feeling better, so let me just stop taking it. This is another way, this is a way resistance can occur because you haven't finished killing the infection. And then you are giving the bacteria the chance to strategize because they've been exposed to the antibiotic. And since you didn't finish killing them off, they'll now strategize a way to now overcome it. Okay. And another common misuse or mishap that people usually do is they tend to take antibiotics for the wrong reasons. I mean, I've worked in a community pharmacy, so I know. They come to the pharmacy and they have a stomach pain, they have a headache, and they want to take antibiotics. Some of them, they don't even feel anything. They are like, they want antibiotics. They demand for it. Why? Because they want to cleanse their system. I've never heard that before as a health professional. Okay, so these are some of the reasons. And one of the most common illnesses that antibiotics are taken for cold, common cold, and flu. These are viral infections. Okay, they are rhinoviral infections. You don't take antibiotic for viral infections. You don't take antibacterials for viral infections. Okay, so these are some of the mishaps. Okay, that can lead to antimicrobial resistance. And another thing that is also not common is we have agriculture. In the agricultural sector, the people that rear the poultry and all that, and the fish, they are into fisheries and all that, they tend to give these animals antibiotics sometimes.
To get bigger.
Yes, not necessarily to get bigger, but to prevent infections. Okay.
I heard someone say they give it to them to get bigger. I mean, Christmas is coming. So yeah.
Exactly. All these funny practices. And then we ask ourselves that where did they even hear all these things from? Mostly it's hearsays and all that. But these are some of the more practices that lead to
antimicrobial resistance.
Resistance.
Even
so to add to what she's saying, like I said, this time around we are also looking at the health workers, okay? I mean, who are just prescribing antibiotics because they feel like, they need to prescribe. Sometimes you realize that some of the antibiotics prescribed are not necessary, okay? And if you prescribe that way, it makes it very difficult for you, the pharmacist, or you, the one who's supposed to give out the medication, to explain to the patient that no, you don't need this, probably let's drop this or that. So we need to look at that angle. And also in Ghana here, in our setting, we are fond of taking medications that have been prescribed for people because it worked for person A, I can also take it. Meanwhile, I don't need it. Okay, we realize that it goes on a lot. From where I practice, I normally see this. They come in demanding for all sort of antibiotics because someone has used it and it worked. And most of them are also local folks. They've been using these antibiotics for over a time now, and they think that that's what helps them. And so when they come to you, they demand that you also give them, the same thing that they are requesting for. You realize that most of them are taking it for funny reasons. Others mix it with all sort of concoctions, and then they take it, and it's that bad. All these practices is what has led to, this antibiotic resistance that we are facing now.
Okay, we are going on a break. When we come back, we talk about the issue of prevention is better than cure. So I want to prevent getting sick, so I'll take antibiotics or antimicrobials. I know you've done some before because I have. I'm also a culprit, so please stay tuned. I'll be back. And then when we are going on a break, we're going to show you a video of samples of what people think about antimicrobials, their views, and then their thoughts. Do watch the video. The pharmacist will speak to it afterwards.
In observing the World Antimicrobial Awareness Week 2020, I wish to contribute that I am fortunate to have known about antimicrobial resistance back in school days by a physical education tutor. And ever since my knowledge about that, I barely take in antimicrobials. And if at any point I have to, it has to be prescribed by a medical practitioner. Basically, I maintain good health practices, and also in uniting to preserve antimicrobials, I, Anoko Ado, regularly entreat family and friends to desist from abuse of antimicrobials. Thank you.
Yeah, welcome back from the break. I hope you enjoyed the comments we had from people, and thank you so much, Dorcas and Okwado, for sending in your video. And I know the animation also summarizes the whole conversation we are having today. You should know how to protect yourself and don't just be taking antibiotics. Before we left off on the break, I was on the point of prevention is better than cure. There are instances where I'm like, okay, I'm about to travel, let me take care of myself. I take an antibiotic, and then I'm like, okay, so I'm fine, I can go. And I do this on a monthly basis. What am I exposing myself to?
Yeah, so like I said from the beginning, antibiotics are not just they are not just given to you because the prescriber feels you need it or you feel you need it. They are not over-the-counter medications. So this is where we need to keep on educating the public that they need to know that there are classes of medications. Okay, you can't just walk to your healthcare practitioner and demand for an antibiotic because you want to cleanse yourself or protect yourself, like you are saying. At any point in time when it needs to be issued, there has to be an assessment to know if you actually need it or not. So there are instances where, from where I work, people come in, and then sometimes the ladies, they come in and they tell you that probably they are done with their menses, and so they need some antibiotics to cleanse themselves, fluconazole and all these antifungals that we have, and they don't know what they're exposing themselves to. What happens is anytime you take antibiotics, okay, you are exposing yourself to resistance. There are instances where the microorganisms in there, some may be sensitive to the antibiotic that you are taking. Others may not be sensitive, they will resist. And over time, if you keep taking these antibiotics, what we realize is that now the resistant ones, okay, now begin to multiply, okay, and they begin to take over your system at a point when you actually need the antibiotic. We give it to you and it doesn't work because you've built resistance over time. So taking antibiotics because you are traveling or taking antibiotics because you want to protect yourself, like you said, is not a good practice. We should desist from that actually. Yeah, so that is what I like to say in regards to.
Yes, and to add to what he's saying, antibiotic resistant bacteria are very difficult to treat. Okay, so this is a reason why we must really prevent this whole antibiotic resistant things, because some of them even lead to life-threatening conditions. I mean, in some cases, they lead to death, and they are also very expensive to treat. So these are some of the reasons why we are trying our possible best to combat antimicrobial resistance or antibiotic resistance. Okay. I'd like to give a few examples of some antibiotic-resistant bacteria. We have MRSA, that is methicillin-resistant Staphylococcus aureus. First and foremost, Staphylococcus aureus is a bacteria that naturally lives on the skin. Okay. On healthy people. Okay. So it's like, it's normal. But imagine when this bacteria becomes resistant to a lot of antibiotics. You get it? And there's a lot of it on your body. You get it? So once it invades your system, it can lead to cases like boils. Okay, it can cause formation of boils that normal antibiotics cannot even treat. You need surgery. You need them to be drained, and you need surgery. Yeah. So something like this, it will be an expensive cause. Sometimes too, they cause when they enter into the bloodstream, they can cause sepsis or bacteremia. That's bacteria in the blood, which is also time-consuming. It's time-consuming to treat and definitely expensive. And we have other microorganisms like Streptococcus pneumoniae. This particular bacteria is also an antibiotic-resistant bacteria. It causes pneumonia, infection in the lungs, and in serious cases, it can lead to conditions such as brain damage or hearing loss. Yes. Or it can also cause infections of the heart and the kidneys and all. So these are some of the things you are trying to prevent. That's what I mean when I say life-threatening diseases. Do you get me? Yeah. It's that serious. And there is also one common one. Okay. Neisseria gonorrhoeae. That's the bacteria that causes gonorrhea. Okay. Okay. And this one can lead to ectopic pregnancy. That's pregnancy that doesn't grow. The fetus doesn't grow inside the womb. It grows outside the womb, which is very, very dangerous. When you have that kind of pregnancy, they have to operate on you and take it out. And that bacteria can cause that. And it can also cause infertility and increase the risk of HIV. Yeah, so these are examples. These are just tip of the iceberg, like examples.
That means we are joking.
We are really joking. We are really joking. And the people out there, sometimes they don't make it easy for us health professionals, because if you've worked in a pharmacy setting, I mean, I've had personal experiences where people come in and they say they demand for an antibiotic, and you ask them, what are you using it for? They get offended because they feel you're not supposed to be asking them that question, but it's because they don't know. Yes, it's personal. Some of them won't even tell you, but they want it. Some too, they'll be prudent enough to tell you that, I've been taking it for this, I've been taking it for that. That's when you can actually chip in your expertise and tell them that, no, this is how it's supposed to be done. Antibiotics are taken when needed, and they are taken on a course. You don't just take them like you're taking vitamins or painkillers. Okay, that's when we educate them. Some of them actually do listen. Others too are very difficult and all that. So I think that by and by, as we keep making this awareness more concrete, they'll get to learn that, this is actually really serious thing that we have to take note of.
Okay. I skipped the part where the video, you have to comment on the video. So let's come back to that. What do you have to say about the video that Doc has sent in? Because she seems like someone who is privy to knowledge about antibacterial.
Yeah, she was actually making reference to the fact that she knows about antibiotic resistance back in school days. It's good. We should ask ourselves how many people know it, and even those who know it, how many people actually put it to use? Because another thing knowing and then practicing or putting it to use. Some people, you do all the talking and then they go back to their old ways. What we need to do, or what we need to realize, is antibiotic resistance has become a threat to the world at large. And so nobody is spared. And so if we are not taking some of these things into use and we are just talking about it, we'll still keep talking about it and the problem will keep on increasing. So for her, yes, it's good. She has an idea, she has knowledge about it, but it shouldn't end there. When they go to the health practitioners, they should still seek for more information and then know how best we can all solve this and tackle this. Like we said, the theme is uniting. To preserve these antimicrobials, antimicrobials. So we all need to come in hand and play our role to help.
Okay. So how, we are coming to the end here, how should anyone use antibiotics to protect themselves and that of the community?
Yeah, so using antibiotics to protect yourself, it depends on what angle you are coming from. Okay, like I said, antibiotics are not just given over the counter. So before it's issued, one, you need to know if you need antibiotic or not, and that should be done by your healthcare professional. They are supposed to assess you and know if you actually need it. One, you are supposed to know the duration in which you are taking your antibiotics and also the required amount or the dosage, because you can't just take it as and when or take any dosage, because it's for a particular purpose to target a microorganism. And so there's a right amount that needs to be taken for a particular duration. And also, you don't need to skip doses, like we normally do. Sometimes we take it for about 3 days. For an antibiotic that has been prescribed for a week, and then we feel we are okay, and then we leave it. And maybe we take it today, tomorrow we won't take it. It's supposed to be taken twice a day. We take just one in a day, and then tomorrow we continue. Okay, that haphazard way of using antibiotics can also lead to antibiotic resistance. And of course, like I said from the beginning, we are fond of taking medications that have been given to people before, and there's something we also need to take note of. We all have different genetic makeups. Even the same antibiotic that may be prescribed for you for that same condition, if I have similar condition, probably the antibiotic might not work. I need a different one. So these are the ways that we can go about to preserve antibiotics. And also it also goes to the prescribers. We should prescribe in accordance with set guidelines. Okay, I know there are instances where prescribers will normally give out certain medications or prescribe based on practices. Okay, there are some things that probably they've learned over time in practice. Yes, you can do that, but all should be in light of the prescribed guidelines, so that we don't go off the guidelines that we are supposed to use. And also talking about the regulators, or the policy makers. Yes, they are doing their work. In fact, they are doing their best. We should all come together and then help them. Spurious medications or substandard medications on the market can also lead to that, because you tell me that probably it's 500 milligrams amoxicillin, but you will check and then it's not even up to that amount or half that amount. Okay, manufacturers and all these people, we all need to come together and then help to prevent this condition. So by so doing, we can help to protect or preserve these antimicrobials, antibiotics.
Okay, but Thelma, don't you think we should make it impossible for people to get antibiotics over the counter? Because if they will abuse it, then they might as well come with a prescription.
That's a good point. I personally wish it would be so, but like I said, it will take time for us to get there, because we live. Let me just use Ghana as an example, because this is where I live and I've worked. Ghanaians are fond of being doctors, self-prescribers. So they've experienced some illness before they went to the hospital and the doctor gave them amoxicillin. So they want to come back to the pharmacy and take that same amoxicillin. For all you know, it may not be the same thing you were being treated for. So it will take some time. That's why we are doing the awareness. It will take some time. And also, I think the people or the public need to know that the different classes of drugs, that some drugs are prescription only. Okay. When we say prescription only the doctors are supposed to prescribe that. Okay. So with that knowledge, they'll know that they don't have to just walk in for an antibiotic. So so that one alone, they need to know that. Okay, there's only in some few cases that pharmacists can intervene if they feel that, okay, this person, they are suspecting a bacterial infection or something, and they can intervene and give. But ideally, it's per prescription, strictly per prescription. So people also need to know that, because I'm sure a lot of people don't know that. So that's also why it comes. So once they know this, at least majority would respect it. So I think we should really put a stamp on that. And secondly, to add to what he said, in order to prevent these abuse of antibiotics, I think the people should also seek advice from their health professionals. Like, instead of expecting antibiotics or wanting them to prescribe them antibiotics, they should ask, what are some of the ways we can treat ourselves without using antibiotics? Because let me just use sore throat, for example. People believe that when they have sore throat, they have to take an antibiotic. It's never true. Well, it's true to an extent. The thing is, there are different types of sore throat, but majority of them are mostly viral, of viral origin, or sometimes allergic origin. Okay, it's only like a handful that are biotic origin, but bacterial, But they believe that because I have a sore throat, I have to take antibiotics. You see, that school of thought must be abolished. Okay, so in that case like this, with a sore throat, you can do a symptomatic treatment. You can, even oranges, oranges can do the trick since they contain vitamin C. Guava is very rich in vitamin C. Aside that, you can gargle warm water with salt. Salt has antiseptic properties. Okay. So, and I also think that, because of, these are some of the things. With sore throat, you don't need antibiotics. You can just go in for the normal, the honey, the lemon and stuff. If it progresses, like if you see that it's still not getting better, then you can go and see your doctor, and then he or she is in the best position to prescribe antibiotics. But you don't come to the pharmacy and demand for the pharmacist to give you an antibiotic. I have a problem with that.
So when they come and they demand and you feel, okay, that is not a thing for them, what do you do about it?
I tell them that, okay, I query them, I ask them questions. I don't just give them because they want to. I need to know why you are taking it, so that if something goes wrong, because if something goes wrong, at the end of the day, I give the drug, so they'll come back to me. So I have to make sure I'm doing my job well. I ask you, okay, so what's wrong? What's the problem? You tell me you have a sore throat. Per my expertise, I'll ask you, how is it like? Because I know that there are different types of sore throat. Okay, so if I ask you and you tell me, oh, there is pain, at least I know that's a sign of bacterial sore. Or it started a week ago or 2 weeks ago. It's been long enough. Maybe there's a secondary infection there. You see, in that case, I can intervene and give an antibiotic per what you've told me. Because per my knowledge and expertise, I know that when there is a sore throat and there's high temperature and there is pain on swallowing, like you can hardly swallow even your own saliva, I know that it most likely would be bacterial origin. Then I can give. But if there's nothing wrong, you're not feeling pain, it's just uncomfortable, I won't give it to you. I'll give you something else, or a vitamin C or something.
Okay.
Yeah.
And they will accept it.
Well, you would. If you don't, then
to add up to what she's saying, with the question you asked, making it impossible for them to buy antibiotics. You see, the issue is, I always believe in education, okay, and talking to people. If everybody is going to listen, there wouldn't even be any need to, create strict laws, because the person will know what he or she is about. Okay. And I'll say this to the public. Now, information is everywhere. People like to read. They like to pull out all sort of things. We always say that when you come, just listen to what your healthcare professional is saying. You might have read an information. It's not bad, okay, to research things. But when you come, also listen to what the prescriber has to say. And by so doing, I'll charge all my fellow colleagues and also the health workers to also, be abreast with issues and also try to educate the client as much as possible. Because you realize that in the long run, it goes a long way to help. Yeah. Even if the person is not willing to listen to what you're saying, then you realize that you might have done your job. At a point, the person will think to some of these things and know that, yes, I was educated or I was told. And so, we can come together and do this wherever we find ourselves. Let's be educating ourselves. I charge the health professionals to also do their job. Let's educate them. As far as antimicrobial resistance is on the rise, or it keeps on going, we shouldn't stop talking about it. Okay. And like she said from the beginning, I believe that it shouldn't be like a yearly thing. Like we come here, we talk about it, and it's done. For me, I employ it day in and day out because we have clients coming in every day to ask. It might be overwhelming, but let's try as much as possible and educate them.
Yeah, okay. And sorry, to add to what he's saying, I think in this case, teamwork on the part of the health professionals is also needed, okay? Because maybe, for example, a person walks into your pharmacy and they want an antibiotic for an unnecessary reason and you don't give it to them, and they go to another pharmacy. When they go to that pharmacy, if they also don't implement that, they wouldn't be helping us. Then it's like there's no coordination in our work. We all have to come together and stand that no, we are not giving antibiotics unless it's prescription basis. Okay. Or if there's a pharmacist there, and the pharmacist can assess the person's symptoms and makes an intervention, fine. That one is a different story. But if we should all come together and do that, these things will be minimal. Because even when the person comes and you don't give it to them and they are angry, and they go to the next place, and they do the same thing to them, and they go to the next place, and next time don't do that. Okay, so at the end of the day too, it also it heavily relies on us. We have to come together and decide that no, we are not doing this. If you want an antibiotic, go and see the general practitioner so that they will assess you there and they will write it for you before. Okay. Otherwise, we are not serving at all. Okay. That is another way that we can kind of abolish the sale of antibiotics.
Because it's a bit too much.
The coordination aspect, it also comes down to the prescribers and the pharmacists. Let me say the doctors and the pharmacists. Okay. Mostly there's this feud. It's like there's an issue going on between us.
The doctor and the pharmacist.
So everybody feels that, I know. And so there's no need, I need to listen to you or whatever. We need to come together and then help. Because if you, the prescriber, you write the medication, it's very difficult when you are trying to make an intervention. Who are you to tell me that, what the prescriber has written is not suitable for me? And so if we are all coming together to communicate and see that this medication, probably it comes to my end, I think probably, Doc, we could do it this way. And he also listens. I think we are all going to help, solve this issue. So the coordination is all round.
All round.
Okay. And then we are still in COVID. We had a lot of azithromycin and doxycycline being used to treat COVID. I want you to throw more light on it.
Yeah.
The use of azithromycin.
I knew this question was coming.
Definitely.
Yeah. You see, like I said, information is everywhere these days. When COVID came, a lot of people started researching. They started taking out stuff. They started searching for information. And here lies the case that President Trump also came in at a point to, speak in favor of azithromycin being used to treat COVID, and there were successes. The next day, what we realized was there was a demand for azithromycin. Even at a point in time, you wouldn't even get azithromycin to buy to treat.
It was that serious.
To treat a common condition. Okay? Just because someone of high repute has spoken about it, and there are some articles online by supposed intellect, okay, to tell us that yes, azithromycin can be used. All these, okay, lead to antibiotic resistance. We already said that antibiotics are not for viral infections. COVID-19 is coronavirus, of course. The name even tells you that it's from a viral source. And so if you are using azithromycin in there, ask yourself, what is it going to do? There were instances, like I said, people use that as an adjunct, okay, to treat the condition, together with hydroxychloroquine and the rest. But we, the health professionals, or probably the health professionals, know why they introduced that. If we come out there and just throw the information out there, the people come in and then they think that it will work for me. It's supposed to treat, my condition. Here lies the case that people were even coming in to buy it to protect themselves, just to take it so that they don't get the condition. Okay, all these, led to or have led to antibiotic resistance at a point. And some people, I know that as time goes on, they may even be taking azithromycin and it will not work because of, this condition that came. So the COVID is something that also, came up. The negative side is there was an increase in demand for this azithromycin, which is an antibiotic. And which can also lead to antibiotic resistance. So we need to watch it. There is a reason why probably a prescriber might be giving you a particular medication. Like I said, always consult. You don't just go out there because you have an information and you demand. And like she said, if they come and they demand and you don't give it to them, there's a problem. We need to look at this. All right.
The pharmacist is wicked. He doesn't want to give me what I want. Okay, so we are wrapping up here. My final question is, pharmaceutical industries are a business entity. They are aiming to make profits. And then there comes antimicrobial resistance. So from a business perspective, I'm thinking, if there's resistance, then it means there's a market. There's a need to supply something that can, cure whatever is resisting this thing. But then these same pharmaceutical industries are telling us not to abuse it. Why is this happening? Is it that we have reached the end of the production of antibiotics or antimicrobials, or why is this happening? Because I'm seeing a business idea in it, but then you're telling us to desist from it.
Yes, it's a very good question. Pharmaceutical businesses are also there to make money, but there's something we all need to understand. It's not, the main purpose is not just to make the money, because there are so many ways you can make money. The main thing is to help the people get better, and in return, the money comes in. So even though you might see a business aspect, it is not easy developing molecules. The antibiotics that we have, if you abuse them, it will get to a point in time that those which have already been produced will not work, and we need to go higher and even produce newer molecules that we haven't seen before. And developing molecules takes time, it takes money, it takes resources for even one medication to come out, for it to be approved for consumption. And so if we are not careful and we don't preserve the ones we have, it will get to a time that it will even be difficult to produce newer molecules. And what do you think is going to happen? We are all going to die because the ones that are already there have been rendered useless because of the abuse. And what we need to know is that the antibiotics that we have, if they were not being abused, probably it would have been easier to use them to treat varied conditions. Because we've abused them, we feel they are no longer effective. And so we need to go ahead and then produce much more stronger one or newer molecules. That is why some of these pharmaceutical companies are always into innovation, because they need to come up with newer molecules to help. It looks like the ones that are already in the system are not working. So even though you are seeing the business side, we are saying that let's protect or preserve the ones that we have, because it's not easy to produce newer molecules. Let me use COVID-19 as an example. When COVID came, we didn't have any medication at that time to treat. So we're being asked to wash our hands, wear our face masks, and do all sort of stuff. Until some of these pharmaceutical companies, started researching, looking out for ways by which we can come up with a molecule. Look at the time that it took. Even though at that time the world was on a standstill, resources had to be developed to be pulled quickly to make sure that these pharmaceutical companies come up with something. Even now that we have some antivirals that can take care of these conditions, and even supposed vaccines that can help, look at the time frame and the number of lives that we lost. Okay, so it's not easy just to come up with a medication. Okay, and look at the business side, because even it will take some time. Yeah. Okay, not that even if you come up with a medication, as soon as you come up with a medication, you're going to make money. It's going to take time. So let's preserve the ones we have. We can even help better advance the ones we have than even thinking of new molecules, because it's not easy in that sense. Okay, so that is what I would like to say.
Okay. Someone, do you have anything to add?
A little bit. He has pretty much said everything. Yeah. But if you look at it, it's more of a loss than a profit. If you are going to be selling antibiotics, I say it's more of a loss than a profit, because let's look at the bigger picture. Okay, we are looking at the future. We are not looking at the now. Maybe the now you make a profit, but in the future they're going to run at a loss, because like he said, there'll come a time when these antibiotics do not work anymore. So we have to find newer ones. And that takes a whole lot of time, because now that you are going to run series of tests, look for the organisms and the resources needed to produce that new drug. You get my point? And so whilst that is happening, you can't even sell the current ones that you have, because they are not working anymore. And majority of your money is going into getting resources for the new ones. So you've actually run at a loss. Okay. And I mean, even whilst they are running the trials, testing the drug to see how best it's going to perform, it takes a whole lot of time. We are waiting for approval and stuff. And even when it comes on the market, it needs to be marketed. Yeah. The health professionals, the doctors, the nurses, the pharmacists, the policy makers, they all need to be aware of this drug and how best it can. They need to be educated on what the drug is coming to do, how best it can perform. Okay. Now we talk about supplies and all that. You see, look at, like he said, he mentioned the COVID. It took a whole year. But by that time, a whole lot of people died. A whole lot of money, resources were pumped into, into these new resources. So it's actually more of a loss than a profit.
Okay, so your final words of advice to the general public, and then ways in which, if we are not going to use antibiotics, how can we, take care of ourselves and boost our immune systems and stuff like that? Your final words.
Okay, so we come back to the basics. Okay, so like as we all know, we wash our hands frequently. Even this washing of hands thing, we should have been doing this before COVID. We had to take COVID to wake us up. COVID was our wake-up call, unfortunately. But yes, we should keep up with the washing of hands regularly and the use of hand sanitizers. Okay, because as we are there, even though we are healthy, we have a lot of microbes on our skins that we can't even see. Okay, I wish we could see them. Then we'd see that we really need to keep ourselves neat. If we could see them, a lot of people would wake up. Okay, an education on how to wash your hands the right way. Some people don't even wash their hands with soap. They just open it and just put their hands and just do something. You haven't done anything. You've rather woken up the microbes. Okay, so you use a very good soap, antimicrobial, antibacterial. We should look out for those. Wash your hands under running water. Okay, use your antibiotics and your personal self. Maintain personal hygiene. Be intentional about it. Keep your surroundings neat. Keep your body neat. And also internally, you have to be taking in your multivitamins. Because that will help boost your immune system. Be looking out for vitamin C, be looking out for zinc. Zinc is also very good in boosting the immune system. And probiotics. These contain good bacteria. We have good bacteria and bad bacteria. Initially, I mentioned pathogenic bacteria. Those are the ones that cause the illnesses. But we also have good bacteria. And sometimes these infections come because there is an imbalance between the good bacteria and the bad bacteria. So we can also be taking in probiotics. Okay, instead of taking antibiotics, we can take probiotics. And examples of probiotic containing substances. We have yogurt, the fresh yogurt. We can be taking that from time to time. And some of the drugs. We have enterogermina. It's in the pharmacy. We can also be taking that. Exactly. So probiotics. We should eat well. Okay, they are really basic. It's nothing over the top. Yes. So these are some of the things that we can do for us.
Okay, Ebenezer.
Yes. Also, to add up to what she says, in any case, if you think you need an antibiotic, when you consult your healthcare professional, don't skip doses if you've been prescribed antibiotics. Don't use antibiotics that have been prescribed for someone else, like we said. Don't make sure the antibiotics that you are taking, you've taken it for the duration that is being prescribed for. If you are taking it for 7 days, make sure you take it for 7 days. At any case, if you feel you need it again, still go back to your healthcare professional, because probably you might not need that same antibiotic. This is what most of them do. They keep the pack, and then when they feel that they are having similar conditions, they walk into the pharmacy with the same thing. Antibiotics cannot be treated that way. Also, those who purposefully keep some of the antibiotics for use at a later time, they should also check that you don't do that.
They should desist.
Yes, they should desist from that. And also, if at any point in time you need to dispose of some medications, make sure you do it well. Okay, medications are, they are very risky. You don't just throw them anywhere, so make sure you dispose them well. So, these are some of the things that I'll talk about, and let all of us come together and help fight this. Thank you.
All right. Thank you so much. It's been a wonderful conversation. Ebenezer says, let's all come together and fight this. And then Thelma says, please desist from, walking into the pharmacy just to demand, please. Also the please account. Yeah. Please stop that. This has been Health Africa on AAU TV. I've had Ebenezer Ajari Bidiakon and Selassie Thelma Amadumako, both pharmacists, discussing or celebrating World Antimicrobial Awareness Week 2020. Do your part. Let's all do our part, and let's desist from such practices. My name is Bridget Amadente. Do stay tuned for other programs.